What's causing this cyst? A cyst is a small pocket of tissue. Genetics, inflammation, infection, or other issues may be the cause of the cyst. Most cysts are benign. If you don't know if you have a cyst, you can take a picture and send it to the doctor. Cyst. A cyst is a group of cells. A collection of pus is not a cyst. A cyst may not need to be fixed. It is not certain if a cyst will be removed in a surgical way or not. After a certain type of cancer is found, cysts are formed as a defense mechanism. The cells that have been affected divide and form a tumor. A cyst is a cell that is dividing and forming a larger one. The closed sac has a distinct envelope and division compared to the nearby tissue, which is why it is referred to as a cyst. What causes a pilonidal cyst? A cyst can cause injury. If the cyst isn't treated, it can get worse. There are some causes of pilonidal cysts that are not known. It can be caused by a skin problem. Think of this condition as if you have a piece of wood stuck in your skin. Pilonidal cyst. There are cysts on the buttocks. They are usually filled with skin debris. If you have infections in these cysts, you are more likely to get a type of skin cancer called squamous cell carcinoma. You can be treated for skin cancer early if you know the symptoms. Will I need surgery for a pilonidal cyst? If you have a chronic pilonidal cyst that has gotten worse and formed a sinus cavity under your skin, you may need to have it removed. The surgeon could either close the wound with a skin flap or packing. Your provider will tell you how to keep your wound covered. They will tell you when to call and when to ignore the signs of infections. Treatment. The cyst wall is the most effective part of the treatment. If an active infection is present, the complete excision should be delayed. A local anesthetic is preferred. A small elliptical incision can be made. An alternative surgical approach can include a punch biopsy and the removal of the cyst. If there is inflammation surrounding it, triamcinolone may be used to help decrease it. An optimal outcome will be achieved by multiple layers of skin. Enhancing healthcare team outcome. Proper patient care depends on timely communication by all members of the interprofessional team. The cyst needs to be addressed quickly to make sure there is no underlying cancer. It is important for primary clinicians to communicate with their patients in an open and honest way to ensure that breast symptoms are not missed. The treatment of the breast cyst can be done with the help of the referring clinician and the surgeon. Complications. Changes to the surrounding tissue architecture, the presence of a breast cyst, and the fine needle aspiration can all affect the mammography performance. It is best to delay mammography by 2 weeks if you want to report the clinical details. If it is not done under sterile conditions, fine needle aspiration can cause breast infections. Fine needled aspiration can cause tumors to grow in the adjacent breast tissue if there is an underlying malignancy. How are sebaceous cysts treated? If a cyst becomes swollen, your healthcare provider may inject it with a steroid drug. You will be given an escort when you have your cyst removed. Don't try to break the cyst yourself. That could cause an illness and cause the cyst to grow back. If the cyst and a small margin of normal skin are removed using a scalpel, it will be done using a smaller incision in the skin. There is a scar after the cyst is removed. The cyst will not come back, but it will likely recur if the lining remains. Cysts need to be removed if they cause hair loss. How can you recognize a cyst? A cyst can appear on your skin. If it's growing under your skin, it may feel like a lump. Unless they are large and can grow on a nerve or blood vessel, they usually don't cause problems. Polycystic kidneys can affect the function. Symptoms of cyst. The signs and symptoms of a cyst can be different. Many internal cysts, such as those in the kidneys or the liver, are not likely to cause symptoms. An image of them may not be noticed until it is taken. If cysts become infections or rupture, they can cause pain. Treatments for cyst. A doctor can drain the cyst by using a needle or catheter. A healthcare professional can use a microscope to look for cancer cells. If they suspect that the cyst is cancer, they may suggest surgery or a cyst wall biopsy. Polycystic ovary syndrome and fibrocystic breast disease are two of the causes of cysts. The treatment will focus on the medical condition. When should you seek help for a cyst? If your cyst becomes very painful, you should schedule an appointment with a healthcare professional. If the cyst isn't causing any problems, they should check it. There are differences in the growths that can be a symptom of cancer. A healthcare professional may want to take a sample. Can cysts and pseudocysts be prevented? There are many types of cysts. Hormonal contraceptives may be able to prevent ovarian cysts. Getting up more often can help prevent cysts. The oil ducts can become blocked if the eyelid line is not cleaned. This may help prevent chalazion. Thank you for watching. Do subscribe, like, and share.